Hi everyone, I'm so excited to be introducing you to one of our international DLD research conference keynotes, which is Dr. Susan Ebbels. Welcome, Susan. I'm so excited to be talking to you this evening.
Oh, thank you. It's morning for me.
It's the morning for you, of course it is. Now, Susan, what will delegates learn from your keynote at IDLDRC this year?
Well, I'm mainly going to focus on intervention studies that we've done with older children with DLD, so aged from sort of 7 and upwards, and mainly looking at our studies that we've done around vocabulary and grammar. But the areas I want to weave in and think about more, which are areas I'm becoming more and more interested in, is how can we maximize the effectiveness and the efficiency of the interventions that we do. So, and that I think I'm thinking a lot around this at the moment, and I'm on a journey here, and some of the earlier studies haven't really thought about this much at all, and some of the later studies much more. But thinking about which targets do we choose to make it maximally effective. You need to be choosing targets that are functional for the child, which will vary with their age. They need to be at the right level, so not too easy, not too hard. And as soon as they've achieved them, you need to be able to move on. You don't want to say, I'm going to spend 10 weeks working on this thing, and actually they get it in 3 weeks. Well, you don't want to spend another 7 weeks working on the same thing. So how can we be monitoring as we go along and moving the child on as fast as we can? And then also we want to be making sure we use techniques that are going to be as useful as possible in supporting their learning, looking at both comprehension and production. And also we want to be using techniques and methods that are going to help them to be able to generalize what they've learned. We don't want them to just learn the few words we've taught them or the few verbs that we've taught them in this particular structure. That's not going to be very useful. We need to be able to encourage generalization. So thinking about that, and then also thinking about how can we reduce the amount of time it takes to achieve a particular outcome. So that might be by putting children in pairs versus individuals, although that might depend on what the target is and which techniques are most useful, because actually if it's most useful that the child does lots of practice, then being one-to-one may mean that they get that practice in much sooner than if they're in a large group. But if actually all they need is to hear something lots of times, it doesn't matter how many children are there, and it might be more efficient to have them in larger groups. So I think it very much depends on what we're trying to achieve and what the best ways are of achieving it. Then also thinking about the distribution of what we do. So do we need to do lots of little and often, or do we need spacing? Our recent work on looking at grammar seems to indicate that actually it's the total amount that matters. And maybe it doesn't matter quite so much how you distribute it. Maybe you could do little and often, or you could do lots but less often. And actually maybe it's the total amount that matters, and we can have a bit more flexibility in some of these things. So thinking around those kinds of issues, as I say, with respect to the work that we've done on vocabulary and grammar, that'll be my main focus.
Exciting. And I think that the thing that clinicians ask all the time is around how do we provide high quality interventions and support. You know, part of the journey is the diagnosis, but a lot of the work that we do as clinicians and those supporting people with DLD is actually providing high quality, or hopefully high quality intervention. So I'm really looking forward to hearing more about your keynote in September. My next question for you is, what are you looking forward to seeing at the International DLD Research Conference this year?
I think it's seeing a range of research from around the world, really, rather than we can get stuck in our little silos in our own country and people that we already know. So it's nice to be able to see what's happening, that anybody in the world can submit something. It's not going to cost them lots of money to attend and things. So actually you get a broader range of people there. And I think having that focus just on DLD is something that brings us all together, and I think that's something that's important. But it's building that community, but within an area, and keeping that focus on an area of need that can quite often get sidelined, I think.
Susan, thank you so much for joining us. We're so excited to be hosting you for the International DLD Research Conference from the 11th to the 13th of September. Please come along and listen to Susan's keynote, as well as join us for our live Q&A session. We hope to see you there.